Hello everyone, and happy almost spring. I am recording this video on March 1st, which means that the days are getting longer, it's going to be getting warmer, the sun will be shining more, things are going to start growing. I can't wait. I really can't wait. I hope you're all well. I wanted to take just a few minutes and talk about the COVID vaccine. I know that we put an article in the newsletter, the latest newsletter about it, but maybe you haven't had a chance to read it. Maybe you didn't get the newsletter. No worries. Let's just take a few minutes. Let's talk about it. So the COVID vaccine right now, there are two brands of the vaccine that are available. That is the Pfizer vaccine and the Moderna vaccine. Both of them require 2 shots that you get in your arm. Pfizer, the shots are 3 weeks apart, and Moderna, the shots are 4 weeks apart. So there is still a limited supply of the vaccine, although every week the state is ordering more and more doses. So the state has tried to be very thoughtful and strategic about the ways that this vaccine gets rolled out and who gets it first, second, third, fourth, so on and so on. Right now, people in Minnesota who are eligible to get the vaccine now include people who work in healthcare settings. Most healthcare providers are eligible, mental health care providers, medical health care providers, people who live or work in long-term care facilities, things like nursing homes, IRTS facilities, some group homes, things like that. Child care providers, people who work in licensed child care settings, and most people who are age 65 and older. That one's a little bit tricky. It doesn't include everyone who is 65 and older, but that it will soon. So if you are age 65 or older and you have questions, please reach out to your healthcare provider, reach out to us, look the information up online to find out when you might be eligible. Okay, let's talk about some facts. Safety. The vaccine is safe. There have been many trials, tests, studies that were done prior to the vaccine being rolled out to the general public to make sure that the vaccine is safe and effective for as many people as possible. So people that were involved in those trials and those tests and those studies included people from all different ethnicities, people of all different races, people of all different ages, so that the Center for Disease Control, the FDA, the people who approved the vaccine, could make sure that it was safe and effective for as many people as possible. Experts from around the world have determined that this vaccine is the safest and the most effective way and the fastest way to get us on the other side of this global pandemic. So if you choose to get the COVID vaccine, and it will be your choice, you are choosing to protect yourself from getting COVID, which is fantastic. You are also choosing, just as importantly, to help your community by slowing the spread of the virus. So the more people that are vaccinated against COVID-19, the slower the spread of the virus is. And the slower the spread of the virus is, then things can either remain open or can open back up that we know and love, right? Places like restaurants, movie theaters, gyms, schools, churches, the CSP. We want these things to either stay open or open back up because they've been closed for so long. And the more people that are vaccinated, the fewer people get COVID, and the fewer people that have COVID, the slower the spread, the safer it is to open those things back up or keep them open. So, Another thing that I think is very important to note is that this vaccine is free. Whether or not you have health insurance, you don't have health insurance, what kind of health insurance you may have, doesn't matter. It is free. It will be free in Minnesota, period. So when you get your shot, you will not have to pay anything. What else? Concerns. People have concerns about the COVID vaccine. Totally understandable. Absolutely understandable. What should you do about that? Well, I think one of the very best things to do is to get as much information as you can, right? We can make our best decisions when we have enough information. In this case, the more information, the better. Where should you get that information? Well, that's up to you. We are happy, any CSP staff is happy to give out information or point you in the direction of some resources and some ways to get information. You can also talk to any medical healthcare provider that you're connected to. You can talk to any mental health care provider that you're connected to. You can call a clinic. You can call the CDC. You can call the Minnesota Department of Health. You can look that information up online. You have a friend that you know has been keeping on top of stuff? Great, talk to that person. As much information as you can get. I would like to provide some resources right now. If you're watching this video, likely you have the ability to access the internet, but maybe that's limited, or maybe you prefer to use the phone. I'm going to give you a few phone numbers. The first one is for the Minnesota Department of Health. It's a really factual, great, easy to digest resource. I love it. Their phone number is 651-201-5000. And I have called them. I have found them to be very easy to talk to, very helpful in terms of answering questions, giving resources. I would highly encourage people to use them as a resource. The CDC, Center for Disease Control. That phone number is 1-800-232-4636. There's also a resource called the Black Community COVID Hotline. And I find that particularly helpful because I know that there are a lot of people of color in our community who, for very valid reasons, have some serious hesitation about not just the COVID vaccine, but healthcare in general. And that is very understandable. And so I think this can be a great resource. And I'm going to give you that phone number. It is 612-254-1145. Another important resource or bit of information is that there is something called the vaccine connector. So as I mentioned, the supply is still somewhat limited in Minnesota, and they are rolling this out in phases. So likely, if you have not gotten the vaccine, you're not sure when you'll be able to get it. And maybe you really want to stay on top of that. Great. You can sign up with this vaccine connector, which will ask you a few questions. It's free, and it will help determine when you may be eligible to get it and connect you to places where you can then go to get it. You can just Google that information, Minnesota Vaccine Connector. You can call the CSP and ask any of us for help getting connected to that, or you can call them and ask for their help in getting set up with it. That phone number is 1-833-431-2053. So those are just a few resources. Please, please, please get as much information as you possibly can from any of the sources that you know and trust. I know that, side effects. I almost forgot to talk about side effects. People have questions about what the side effects are from the vaccine. The majority of people that experience side effects, which is not everybody that gets the vaccine. Some people have no side effects whatsoever. Other people maybe have side effects after their second dose, but they didn't have them after the first dose. Other people may have some side effects after both doses. It really varies, just depending on the individual, right? Everybody's different. The most common side effects that people do experience who have side effects are a sore arm at the spot where they got the shot. That can last from 1 to 7 days. Fever or chills, headache, feeling tired, having some body aches. Those are all the most common side effects that people have. And again, the Minnesota Department of Health, the CDC, the healthcare system that you wind up getting the vaccine through, if you get it, those are all places that are trying to track what side effects people have if they have side effects. So if you are someone who has already gotten the vaccine, likely you have been asked questions afterward about how you've been feeling. Have you had a headache? Do you have a sore arm? Have you taken any ibuprofen? Has that been helpful? Those kinds of things. And that's just a way for people to track how many people are experiencing side effects, and again, make sure that the vaccine is as safe and effective for as many people as possible. So you've all been listening to me talk for almost 12 minutes now. I won't keep you going, but I really just want to encourage you all to get as much information as possible. Reach out to us, reach out to anybody online or the news or your medical providers, your mental health care providers, anybody that you trust to get information from to inform yourselves. And I hope that you're all staying well. I hope that you're all staying healthy. I miss you all, and I will hopefully see you all soon.